is we need to bring the cost of health care down.
Yes.
So we need to bring the cost of health care down. Unfortunately, in 2010, when the Affordable Care Act was passed, the reason why it may have been 15 years, but the purpose of the Affordable Care Act was to bring costs down. It was sold as to bend the cost curve down. It would save $2,500 in premium cost, and if you liked your doctor, you could keep your doctor, and if you liked your health insurance plan, you could keep your health insurance plan. The Washington Post gave President Obama 4 Pinocchios for those lies. So we have not seen the cost of health care come down. There's a variety of reasons for that. First and foremost, what have we done? I continue to advance bills on pharmacy benefit managers to lower the cost of prescription drugs. I have done that in the state Senate, and I have done that in Congress. We almost got those through.
You have to pass
to get those through. We passed the energy in Congress. We passed it in the House. Lower cost, greater transparency. So
be a leader
on that. Within the Working Families Tax Cut, we also have provisions for direct primary care, which is absolutely a way to reinforce the doctor-patient relationship and have access to your provider, as well as increasing health savings account to allow people to have more control over their healthcare dollars. So we're going to continue to work on those, to pass those, and work to get healthcare costs down for individuals.
What comes after the ACA?
Pass Medicare for all.
What's your plan?
Okay, so
are you getting paid? I want to know, ma'am, are you getting paid right now? Have you donated your
I am not getting paid. I've already answered the question, ma'am.
okay. So Mary and Shelley both have similar
I think
questions.
we've all heard what we have to say, what we don't have to say, and I think it's time that we vote you
All
out.
right.
Vote her out!
I'm going to ask the next question.
This question is basically
Vote her out! 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 Vote her out!
Attention's there. What is no? How are you going to win again? Basically, what are you going to do to address the concerns of Southeast Iowans so you can continue to support?
So this is, I'm here in my official congressional capacity, so I'm not going to engage in an ethics violation. Needless to say, I will continue to do what I have done every single year that I have been in office, and that is I will continue to meet with constituents in D.C. I will continue to meet with constituents in Iowa. I will visit, I will tour, I will work on legislation that is trying to make cost of living more affordable for individuals, to improve economic hardship, to be able to support our communities. In our Ag-Approach bill that may be passed, our funding that we were able to get for the Newton YMCA for their child care of $2.7 million is in that bill. Our support for the Keosauqua Hospital of $825,000 is in that bill. And our support also for the hospital in St. Luke's up in Jones County. Those are 3 projects that are going through that will be passed in this legislation when we get this passed.
Is any of that something that a Democrat wouldn't do?
So all of those things will continue to work, continue to meet with people, continue to advance legislation to make the lives of the American. Furthermore, on the Affordable Care Act or the Unaffordable Care Act, there was no change.
What's your plan? What's your plan after it?
There was the subsidies and the premium tax credits are unchanged in the Working Family Tax Cuts. Those were not touched, nor were they touched in the continuing resolution. It is 100% true. The premium tax credits do not expire. They were not expiring. What expired was COVID-era enhanced premium tax cuts, where that money goes directly to profitable insurance companies. It was a corporate to the health insurance companies done by the Democrats in 2021.
Yeah, stop paying them! Single payer!
And then they were redone in 2022 through the IRA. Those are enhanced premium tax credits. It's minimal number of people. It is.
How much are rates going to go up? How much?
The ACA premium tax credits were not changed. That's in the regular appropriations process.